Senator Brown is inside, and it's really important right now to make a statement about access to preventative health care, women's health care, and access to birth control, that everyone should be playing by the same rules. And that's the message for Senator Brown today. Hands off birth control, hands off preventative health care, hands off mammograms. Let women's health care stand.
Senator Brown needs to realize that he's affecting women's lives, and it's not acceptable.
Just want to say I have two little ones. I have a 21-month-old little girl and a 4-year-old little girl, and because of access to birth control, I was able to wait until I was 30 to have my first child and not be in a situation where I had an unplanned pregnancy. So I feel really fortunate that you know, while I was in college, and then when I was out of college and started working on my own, that I was able to first through my parents' health insurance and then through my own have coverage for birth control, which allowed me to select when I wanted to have children.
We have a 17-year-old daughter who over the past couple of years had to go to the emergency room quite a few times, and it was very disturbing for us. And it turned out that she had endometriosis, and endometriosis is controlled by birth control pills. And through that, all that pain and suffering that she had was ended through birth control. So there's a lot of good reasons why we need birth control.
It's about healthcare for each and every one of us, because each and every one of us are part of the society, and we want to be a healthy part of the society. So if we don't have our choices and what we need to take care of ourselves, then we'll be a sick society.
Went in to talk to him about the Blunt Amendment, and you know, I'm a student at a Catholic university, and I went up to him and he kind of brushed me off. And I told him that as a student at a Catholic university, and you know, with my future employer, does he think that they should be able to deny me access to birth control? And his answer, he kind of brushed me off. He repeatedly told me that it's a red herring, that I should get my facts straight, and that as a student at Boston College, I should know what I'm talking about.
But you do know what you're talking about.
I do know what I'm talking about. I'm also involved in the organization Boston College Students for Sexual Health, and I know a lot about sexual health and contraception access on Boston College. And so I was really offended that he acted like that I wasn't informed.
I talked to Senator Brown this morning and told him that I was really upset about the fact that he was sponsoring a bill where an employer would have a right to say whether I could have a mammogram or have a cancer screening test. That I didn't think an employer had a right to decide what my health care was.
And what was Senator Brown's reaction to that?
He said I didn't have my facts right. It's outrageous that there's any intrusion into my health care by a senator or by government. It's not what he's supposed to be doing there. And I said, what's more important that you should be doing there is working on jobs.
I'm going to do some disability